All right, let's talk about something we've all probably felt at some point, that nagging, annoying pain right in your upper belly. What is that really? Is it just last night's pizza, or is it a clue to something bigger? Well, today we're putting on our detective hats and investigating exactly what your body might be trying to tell you. So yeah, what does it really mean? That ache, that burning sensation? It's not random. It's a signal. Your body's sending you a message. The problem is, it can feel like it's in a different language, right? Don't worry, by the time we're done here, you're going to have a much better handle on how doctors crack the code. Okay, so our investigation starts with a really common culprit, something most of us just write off as heartburn. But you know what? That's often just scratching the surface. And to do this right, we're going to follow two totally different patient cases. Think of them as our case files. Their stories are going to show us, step by step, the kind of detective work doctors do to figure out what's really going on and how to fix it. All right, let's crack open case file number 1. Our first subject is a young guy, and his symptoms, well, at first glance, they seem pretty simple. But, any good detective will tell you the devil is always in the details. So here's the rundown on our patient. He's 27 years old, and for the last 3 months, he's been complaining about what he just calls heartburn. But let's look at the actual clues, okay? He's got this burning sensation right in the pit of his stomach. He feels full super fast when he eats. That's a big one. And he's belching a lot. Now, here's what's not happening, and this is just as important. No weight loss, no blood in his stool. Every single one of these details is a crucial piece of the puzzle. Okay, so this collection of symptoms actually has a proper medical name: dyspepsia. And this is a really important distinction to make. Heartburn is just that one feeling, the burning rising up your chest. But dyspepsia, that's the whole package. It's the pain, sure, but it also includes that weird, I'm full after 2 bites feeling. It's a much broader clue, which means it could be pointing to a whole lot more things. And I mean a whole lot more things. Look at this list. Dyspepsia isn't the disease itself, you see. It's just the alarm bell. The actual culprit, our suspect, could be anything from Gerd to a peptic ulcer, a nasty little bacteria called H. pylori, even cardiovascular issues. So the doctor's job is basically to be a detective and start ruling out suspects. So where does a doctor even begin with a list that long? Well, the first thing they do is scan for red flags. They're looking for signs that this might be something more serious. In the medical world, they call these alarm features. And here's what they're looking for. Are you losing weight without trying? Is it hard or painful to swallow? Is there a family history of stomach cancer? Things like that. Now, back in the day, any one of these alarm bells would mean you're getting an endoscopy, no questions asked. A camera down the throat. But this is where medicine has gotten a whole lot smarter and, honestly, more practical. Now, the biggest factor in the investigation is your age. If you're under 60, like our guy in the case file, the chances of it being cancer are super low. So it doesn't make sense to jump straight to an invasive procedure. Instead, the strategy is, let's test for a really common bug called H. pylori first. But if you're over 60, that risk profile changes, and heading for an endoscopy to rule out the bad stuff is absolutely the right call. So how do you even hunt for this H. pylori bacteria? Well, the good news is there are some really great, easy, non-invasive ways to do it. The top 2 are the urea breath test, where you basically breathe into a bag after drinking a special liquid, and a stool antigen test. Both of these are fantastic, like over 95% accurate at finding an active infection. That's the key word, active. There's also a blood test, but it's a bit tricky. It can only tell you if you've ever had H. pylori, not if it's the thing causing your problems right now. So for our patient, that breath test or stool test is the perfect next step. Okay, so let's put that case on pause for a moment and open up our second file. We've got another patient with upper abdominal pain, but as you're about to see, the clues she's giving us, they're going to send our investigation down a completely different path. All right, meet patient number 2, a 45-year-old woman. And just listen how different her story is. The pain isn't in the middle, it's on her upper right side. And get this, it radiates or travels all the way up to her right shoulder. It kicks in right after she eats a meal and then just sits there for hours. On top of that, her medical history gives us even more clues to work with. This specific set of clues, the location, the radiation to the shoulder, the timing with meals, it all points to one prime suspect: biliary colic. And here's a fun little medical fact for you. The name is completely wrong. When you hear colic, you think of a colicky baby, right? That sharp coming and going pain. But biliary colic isn't like that at all. It's a steady, constant, dull ache that's caused by a gallstone that's gotten temporarily stuck on its way out of the gallbladder. So we have our prime suspect, gallstones. What's next? Well, we need evidence. We need to get eyes on the culprit. We've got to confirm that the suspect is actually at the scene of the crime. But before we look for the stones themselves, let's talk about who's most likely to have them in the first place. This is a profile of the usual suspects, so to speak. Things like obesity and diabetes are big ones, and they fit our patient's profile perfectly. But it's not just that. Pregnancy can do it, certain diets, even fasting for a long time can put you at risk. Okay, now I want you to look at this number, 80%. This number is absolutely crucial to solving this case. 80% of what? What could this possibly have to do with finding gallstones? Here it is. A massive 80% of gallstones are made of cholesterol, not calcium. And you know what that means? They don't show up on a CT scan. They're basically invisible. This is so important. You could be having terrible pain, get a CT scan, and be told everything looks fine, all while your gallbladder is packed with stones. And that is precisely why the best tool for this job, the gold standard, is an ultrasound. Okay, so let's say the ultrasound comes back positive. We found the gallstones. Case closed, right? Well, not so fast. Just finding them isn't the end of the story. The final verdict, what to actually do about them, all comes down to one single, simple question. And that question is, are these stones actually causing the problem? For our patient in this case file, the answer is a big, resounding yes. She's having those painful biliary colic attacks. And because of that, the only way to stop them for good and prevent something worse from happening down the line is surgery, to take the gallbladder out. It's called a cholecystectomy. This really breaks it down perfectly. You've got two scenarios. On one hand, you have asymptomatic gallstones. These are stones that a doctor just happens to find on a scan for something else. You didn't even know they were there. In that case, you just watch and wait. The risk of them ever causing a problem is pretty low, only about 20% over your whole life. But on the other hand, once they start causing pain, like with our patient, they become symptomatic. And that changes everything. Now the risk of future problems is high, and the right move is surgery. So think about where we started. One symptom, upper abdominal pain. But by following the clues, we went down two totally different investigative paths, found two totally different culprits, and ended up with two totally different solutions. It's pretty amazing, right? So the big takeaway here is that the details really, really matter. Where is the pain? What does it feel like? When does it happen? Those aren't just minor points. They are the vital clues. Your body is telling you a story. The real question is, what is it telling you?